All right, welcome to Plant-Based Kidney Health, everyone. Michele Crosmer, Renal Dietitian here, and I have a very special guest on today, Melanie Betz. Melanie is a fellow registered dietitian. She is board certified in both renal nutrition, geriatric nutrition, and she specializes in kidney stones and prevention of kidney stones with food and nutrition. So thank you so much, Melanie, for coming on. And do you want to share a little bit about yourself, both professionally and personally, before we get started?
Sure, absolutely. I am so excited to be here. Thank you so much for having me, Michele. Like you said, I'm a registered dietitian. I specialize in kidney stone prevention. I spent the last 6 years of my life or so at the University of Chicago, where I kind of fell in love with kidney nutrition in general, and specifically kidney stones, because there's a very well-known stone department there. And honestly just sort of fell into this, and I was just fascinated. There's so much to know. I realized how much I didn't know, and have really just kind of ran with it. And so that is when I started the kidney dietitian. So you can find me at thekidneydietitian.org, or I'm on Instagram at thekidneydietitian. I have all sorts of resources for people with kidney stones looking to learn what you can actually do to prevent them, because there's an awful lot of misinformation out there, as there is with all areas of nutrition, I suppose. So yes, you can find me there. And if you want to work with me, I have a kidney stone course, which is Kidney Stone Nutrition School. You can go to my website, thekidneydietitian.org, and learn a little bit more about that if you want to work with me more one-on-one to help prevent stones.
Awesome. And you have some, for if there's any other registered dietitians or renal dietitians that are watching this, you have some resources for them as well.
Yes, thank you for bringing that up. I almost forgot. It's it's a new resource, and I'm so excited about it. So yes, I have kidney stone dietitian training, which is brand new, and I'm so excited to offer it because there really are no resources for dietitians for kidney stones. And so yes, if you are a dietitian listening, definitely check that out, because I want to help all of us kind of be on the same page with stone nutrition, because I feel like a lot of us might be saying different things, which isn't ideal, obviously, for our patients. So again, you can find that at my website too, just thekidneydietitian.org. Just go to the shop tab, and you'll see all of those different resources.
Perfect. And I'll include that in the notes as well for this episode,
Perfect.
so anyone can
Yeah.
find that link there after they watch it. So just to get started and dive right in, then, Melanie, can you tell people about what are the different types of kidney stones? Which ones are more common? Which ones are least common?
Yeah, absolutely. So there's sort of four main types of stones. The one we hear about most often is calcium oxalate, which is for good reason. It's by far the most common. About 80-ish% of kidney stones are calcium oxalate. There's also calcium phosphate, which is maybe 5 to 10-ish%. So pretty common. Uric acid stones, 5 to 10-ish%. I lied. There's like five types of uric acid. And then very rare stone types. There's struvite and cystine stones. Struvite stones are almost exclusively related to infections, so sort of recurrent UTIs. You see that with people who have maybe indwelling catheters. So those are kind of very rare and in a very specific situation. You can also have cystine stones, which are also very rare, and those are almost exclusively related to a genetic disease called cystinuria. So those we don't really talk about, but the three main types of stones that are most common, that definitely all do have nutrition considerations, are calcium oxalate, calcium phosphate, and uric acid stones.
Okay, got it. And how does someone know what kind of stone they have?
Mm, Good question. So, of course, really the only way that you can know for sure what kind of stone you have is if when you pass it, or if you have surgery to blast it or remove it, then they can analyze those fragments and see what kind of stone it is. I will say a lot of people will say, like, "Oh, I'm so confused. I don't know what to eat because my stone was maybe 80% calcium oxalate and 20% calcium phosphate or something," which is very common. It's actually
Okay.
rare to have a stone that is 100% one type of stone. So if you get those results back, like, know that that's normal and no need to panic. That's what most people have. So that's the only way to know for sure what kind of stone you have. If you know that you have a stone. Maybe they discovered one on a scan, or coincidentally, for whatever reason, you haven't passed it, but you have stones in your kidneys currently. You obviously can't like go in and check it, but that is one of the many reasons why a 24-hour urine test is really helpful. I would say, and the American Urological Association would say, that everyone with a kidney stone essentially should have a 24-hour urine test, because that is really the only way to know what caused your stone. There's lots of different causes for stones for the same type. So even if you haven't passed a stone and you haven't had a chance to analyze it, or maybe you passed a stone and couldn't catch it or whatever, or they didn't date, sometimes even the surgeons don't send it to the lab to have it tested, that 24-hour urine test will give you a pretty good idea as to what type of stone that you have, or what type of stone you're making. And honestly, even more importantly, it'll tell you what's kind of off in your urine chemistry that is predisposing you to make stones. And that is where the good stuff is, where we can really sort of target and come up with an effective prevention plan.
Okay, awesome. So 24-hour urine test is very important for people who have had a kidney
Yeah,
stone in the past or currently have kidney stones to
correct.
see what's
Correct.
going on with their urine and individualize things. Okay. So
Absolutely.
before I guess we get into some of the individual nutrition recommendations based on certain types of stones, are there general recommendations nutrition wise that kind of across all forms of kidney stones people can make in their diet?
Yeah. Honestly, the only thing that is consistent across all stones is drinking a lot of fluid. um, so that is going to be important for literally all 5 types of stones that I mentioned earlier. So technically, the goal is to drink enough to create at least 2.5 liters of urine per day. If we can get it to 3 liters, that's even better. So for most people, that means drinking around 3 liters of fluid, because we lose some fluid from like talking and sweating and feces and those types of things. So for most people, we want to aim for around 3 liters of fluid per day. And that does
Okay.
include all types of fluid. Like obviously most of it should be water, but I totally understand that water gets kind of boring. And so even things like coffee, milk, I'm sure we'll talk about calcium later, even fluid in foods does technically, eventually will raise your urine calcium, or raise your urine volume if you're eating a ton of watermelon or something like that. So yes,
Okay.
so technically all fluids do count towards that 3 liters.
Okay. Good clarification. So water is ideal. And I think there's a lot of confusion. People ask a lot, well, can I have tea or can I have coffee if I
Mm.
have kidney stones? So can you address that?
Yeah, of course. So coffee, absolutely. So both coffee and tea are actually associated with reduced stone risk. There actually may be a slight benefit of caffeine because of that diuretic effect. It might actually lower the concentration of your urine, making stones less likely. Of course, that doesn't mean that we should go drink tons of caffeine, because that could impact our health otherwise. But having a few cups of coffee per day, totally fine, as long as it's not full of sugar, because then that could actually increase your risk of stones. That's actually the only fluid or only beverage that can increase your risk of stones is sugary stuff. So regular soda, sweet tea, punch, and those types of things. So tea is very controversial because black tea has oxalate in it, a fair amount. However, we see in all studies that I've ever seen, black tea is associated with a lower risk of stones, kind of really just highlighting how important that fluid is. I know it's boring advice, but truly the most important thing that you can do to prevent stones is to drink a lot of water. All the other stuff is great, but if you're not drinking a lot of water, it's not really going to matter. So tea, I say, is completely fine despite the oxalate content, because we see a lower risk of stones. Now, there are some people who have super stubborn, very high urine oxalate, and then I think it does maybe make sense to maybe limit how much black tea you have. But for the vast majority of us, I think black tea is completely fine.
Okay, great. So if we think of, is it okay for you? I mean, if we think of just the most common types of stones,
Yeah.
are you okay going into both like uric acid, calcium phosphate, and then calcium oxalate, since the calcium oxalate is the most common, and we'll focus the most on that, and just maybe a few pointers on calcium phosphate, uric acid stones and diet, and then we'll really dive into
Yeah.
calcium oxalate
May-
stones and diet.
Maybe what we could do, because honestly, there's so much overlap between the three main types of stones:
Okay.
calcium oxalate, calcium phosphate, and uric acid. I think maybe kind of touching on all of the possible pieces of diet that might matter for you. Because truly, again, especially calcium phosphate and calcium oxalate, there's a ton of the same stuff. And uric
Okay.
acid may have some different considerations, but it all kind of comes down to the same things. And really all of this has to be directed by that 24-hour urine test. And I'm sure I'll bring that up as I kind of go into all the details, but really thinking about nutrition based on those risk factors in your urine. The stone type's great, but we really want to really target it on those urine risk factors. So,
Yeah. So
yeah.
let's dive into those urine risk factors. Yeah. So
Sure.
what are they? And if someone sees any of those, then what are they doing food wise?
Yeah. So from a real high level, the most common urine risk factor that you'll see, other than low urine volume, which just means drink more, right? The most common urine risk factor is actually high urine calcium. And this is the number one cause of calcium oxalate stones, as well as calcium phosphate stones. And so this, it's kind of funny because I feel like we assume that high oxalate is often the cause, but that's really not the most common, which is one of the reasons why that 24-hour urine test is just so important. Because if your urine oxalate isn't high, then there's really no reason to limit how much oxalate you're eating. Certainly no reason to limit it very strictly. So it's just so important to know what's going on. That's going to direct all of what we're doing. So again, that high urine calcium is the most common risk factor. And the number one thing that you can do to lower the calcium in your urine is actually to limit how much sodium you're eating, or make sure you're eating a healthy amount of sodium or salt. So the recommendation for people with kidney stones is actually the same as people with kidney disease. So, and the general population for that matter, which is 2,300 milligrams of sodium per day. So yes, that urine calcium is by far the biggest one that you'll see.
Okay. And does the amount of calcium someone is eating affect their urine calcium levels?
So that is a very complicated question. I'm gonna hopefully try to give you a concise answer. So yes, a little bit. So we know that when you eat calcium from, say, milk, or even calcium in, say, like broccoli or something like that, it probably will raise your urine calcium a little bit. However, we see very strongly that people who consume enough calcium from food have a lower risk of kidney stones, which I know is very counterintuitive because I just told you that high urine calcium is the number one cause of stones. But bear with me. So, when you eat enough calcium, um, that calcium loves to bind with oxalate, and any healthy dietary pattern is gonna have oxalate in it because there's some oxalate in literally all plant foods. So if you're eating a healthy diet, you're gonna be eating some oxalate. And so when we eat enough calcium, that calcium binds with oxalate in our intestines, and we excrete that oxalate in our feces. Instead of that oxalate getting absorbed into our GI system and eventually getting excreted in our urine, therefore increasing the risk of stones. And so actually the number one thing you can do if you do see high urine oxalate on a 24-hour urine test is to make sure that you're getting enough calcium. And for most people that I work with, just simply getting in enough calcium, you see that urine oxalate come tumbling down and you're totally fine, and you can enjoy fruits and vegetables with no concerns. So yes, so that calcium is so important to kind of help bind that urine oxalate and reduce urine oxalate levels, essentially. In addition, people who have kidney stones are actually at a much higher risk of bone disease, so bone fractures, osteoporosis, and those types of things. And just because of actually all of that high urine calcium. So for whatever reason, many people who form stones, our body just really wants to keep that urine calcium high, unfortunately, at the expense of our bones. So that's kind of where that connection comes from. You can see how,
Okay.
our body sort of constantly breaking down that bone, excreting urine calcium, so your bones are at risk. And so making sure that you are eating enough calcium can help protect your bones as well.
Okay. So if you have high urine calcium levels, it's low sodium, diet's important. If you have high urine oxalate levels, getting enough
Mhm.
calcium in your diet's the most important. And we're going to definitely dive more into oxalates in food specifically. But what other things in the urine, 24-hour urine test might come up where you would make some nutrition
Yeah.
tweaks?
Yeah. So there's lots of things. I think the other big one is low urine citrate. So citrate in your urine is a very good thing because it makes calcium-based stones more difficult to form. It basically makes it harder for calcium oxalate or calcium phosphate to bind. And
Okay.
so people can form stones just by not having enough citrate in their urine. It's a pretty powerful inhibitor of stone formation. And so this is where you hear people say like, oh, I put lemon juice on things, or, oh, I'm eating a lot of oranges because there's citrate in it or whatever it is. And that's fine, but in order to really move the needle with that urine citrate, there's more effective ways of going about it. If you are going to use lemon juice, it can work, but you need to drink a lot of lemon juice, like somewhere around a quarter to a half a cup of lemon juice per day is what actually is going to move the needle with that urine citrate. Um, so again, if you're squeezing a lemon wedge in your water, cool if that makes you drink more water, but it's probably not gonna actually put more citrate in your urine. And actually, so citrate is a base when we think about acid base pH world, right? Citrate is a very powerful base. And so when we eat a dietary pattern that produces less acid, I imagine you've probably talked about this on, on this channel before,
Yep.
because we talk about that a lot with kidney disease as well. When we eat less acid, our body doesn't need to hold on to that base as much to neutralize the acid from the foods that we eat. So eating literally any type of fruit and vegetable that's going to produce base, which is literally all fruits and vegetables, that will sort of push your body to excrete more citrate in your urine because it doesn't need it again to neutralize that acid from the diet.
Okay.
So yes, so literally any fruit or vegetable can raise urine citrate levels. We don't necessarily need to focus on those citrus fruits necessarily because the citrate in them isn't really what we're after. It's actually, we're just after like the general alkali that we find in all fruits and vegetables. And the flip side of that, of course, is if you have low urine citrate, making sure that you're not eating too much animal protein specifically can help, which produces acid, can help increase those urine citrate levels as well.
Got it. Okay. And what else? Anything else in the urine? What about pH?
Yeah, oh my gosh, I mean, I could talk for hours. All right, let's put one other really big one. So this will flow well. So the next common thing that I see is having too much acid in your urine. So having low urine pH, which makes you more likely to make calcium oxalate stones, but this is a very big driver of uric acid stones. Low urine pH is you can't form uric acid stones unless you have a very low urine pH or too much acid in your urine. And so, sort of just like the citrate thing we were just talking about, the best way to get your urine pH up is to eat lots of fruits and vegetables and to make sure that you're not eating too much non-dairy animal protein because that non-dairy animal protein is what produces acid that eventually gets excreted in your urine. So we just want to,
Okay.
yeah, lots of alkali from fruits and vegetables and less acid from animal protein.
Okay. So I'm anticipating questions on, okay, the recommendation is to eat more fruits and vegetables, but then fruits and vegetables contain more oxalates. Can we
Mhm.
dive into that very confusing, lots of misinformation around oxalates and how much someone should have and how, like, what's the truth behind that?
Gosh, I mean, again, I could talk for 17 hours on that. um, so yes, oxalate has been demonized, and it makes sense, right? So calcium oxalate stones are by far the most common, and urine oxalate. We don't want to see that high. That is absolutely true. However, we've sort of assumed that high urine oxalate is the cause of all stones. So often people come to me and they had a stone, they got it analyzed, it was calcium oxalate, they never did a urine test, and the doctor just gave them a list from 1973 of high oxalate foods that is not accurate probably, and like, hey, like this is what you can do. And like, oh my gosh, like so many things. Because one, we know that that person likely didn't even have high urine oxalate to begin with. That's likely it was calcium or dehydration or something that was causing those stones. But even if urine oxalate was high, we now know that calcium is actually a much more effective way to get that urine oxalate down rather than trying to stress about a low oxalate diet. Um, in addition, this low oxalate diet sort of assumes that how much oxalate we eat equals how much oxalate is in our bodies. And like oxalate metabolism is very complicated. And we do know that eating less oxalate will reduce the amount of oxalate in your urine. However, I would argue that it also would put you a low oxalate diet is going to be limiting a lot of things that we know are really good for kidney stones. In addition, oxalate metabolism is very complicated. Your gut microbiome has a big role to play in oxalate metabolism, where that oxalate is coming from, what other foods you're having that oxalate with. Are you having that calcium? Like there's so many things that are going on. So simply only focusing on limiting oxalate in this very strict way to limiting oxalate to say, sometimes people say 50 milligrams of oxalate, and that is so low. Like I think you literally could not put together a healthy diet, a diet on a 50 milligram oxalate. Some people say 100, which is more generous, but still I don't recommend counting oxalate like that. Again, oh my gosh, I'm on, on a soapbox. I could go on and on, because it's impossible to know also how much oxalate is in everything you eat. Like it's so difficult to know. We often talk about the Harvard oxalate list, which is definitely considered to be the gold standard, and we know that the oxalate amounts on that are as accurate as we can get. But obviously, there's not all foods on there, so it's really, really
Right.
difficult to actually track how much oxalate you're consuming. Um, in addition to knowing like if you even have to. So like I said, I'm all over the place with this. I'm very passionate about oxalate. So I think, so if you do find that you have a stone, I think the first thing you need to do is to get that urine test. And if your urine oxalate is high, get enough calcium in. Get another urine test. If you see that your oxalate is still high, do some assessment and see if you have some very concentrated sources of oxalate. Because I do see people getting into trouble sometimes if you're doing, like a spinach smoothie or you're having a spinach salad every day. Because spinach specifically is very high. So there's around like 750 milligrams of oxalate per half cup cooked spinach. The next highest thing is almonds that have 120 milligrams. So spinach is
Wow.
like crazy high. So you can see, and almonds, are pretty high too compared to some other high oxalate foods. So look and see like, oh, am I having a spinach salad every day? Am I juicing things? Because oxalate is water soluble. So when you juice something, you're going to get a huge dose of oxalate all at the same time. Whereas if you just ate that fruit or vegetable, you're not going to get as much. I sometimes see people getting into trouble with supplements. So specifically cinnamon and turmeric supplements. Those two spices are pretty high in oxalate. So using cinnamon and turmeric on your oatmeal or in a curry, like no problem. Like realistically, you're not going to eat that much. But in supplement form, again, it's very, very concentrated. So that is maybe where we see problems. So again, just kind of assess and see, am I accidentally binging on an oxalate or these very high oxalate foods in some way? A lot of times I see it with almonds. So, people on gluten-free diets, a lot of times gluten-free products are made with almond flour, which is just soup, it's just ground down almonds. That's
Right.
very, very concentrated. So I think my point is oxalate matters, but we don't need to, most of us, 99% of us do not need to be on these super low oxalate diets. I think we need to maybe avoid huge doses of oxalate. We need to make sure that we're getting enough calcium. And then for all of those other fruits and vegetables, we should be eating them because we see that people who eat more fruits and vegetables in general have a lower risk of stones. Fruits and vegetables are very high in things that we think that are good for stones. So things like magnesium. Magnesium most comes from nuts, which are notoriously high in oxalate. Also alkali. So we talked about how that kind of plays into stones. So all fruits and vegetables are going to help us there. They're also something called phytate. If you Google phytate, it comes up as this big scary thing because it's an anti-nutrient. It's but for stones, we actually think it's good because phytate is a very, very strong inhibitor, even stronger than citrate, actually, stronger inhibitor of kidney stone formation. And so phytate comes from whole grains, which are restricted on a low oxalate diet. So yes, so lots of good things in all of these foods that are removed on a low oxalate diet. And so I truly feel that a strict low oxalate diet could actually be doing harm because it removes all of these good things.
Yeah. And thank you for saying that.
Any
And, we
questions
see,
about that?
yeah, we see that in it's so important looking at the diet as a whole versus just one single nutrient with kidney
So
stones
important.
and kidney disease for this reason
Yeah.
that if you're following a very low oxalate diet, you're missing out on these other things that can actually help prevent kidney stones.
Yeah.
So
It's
let's say,
the
so
same
number one,
thing.
I was just saying, number one, ensuring adequate calcium. Potentially if they have high urine oxalate levels, then avoiding those very high oxalate foods. Aside from spinach and almonds, what are some of those other very high oxalate foods that someone
Yeah.
might want to watch?
Yeah, so spinach, like I said, is truly by far the biggest, like truly 7 times more than anything else. But almonds are pretty high. Navy beans specifically, sometimes all beans and all nuts get ostracized, but navy beans and white beans, for whatever reasons, the way God made them, I don't know. They're just very high in oxalate. But other than that, like there's not a lot. So sometimes so baked potato with skin, the skin has a lot. The potato does too, but the skin is very concentrated. Raspberries, rhubarb, and beets are
Okay.
sort of those highest ones. But other than that, just eat fruits and vegetables and get your calcium in. You'll be fine.
Yeah. There's plenty of other options of fruits and veggies if you
So
do
many, right?
need to leave those out.
Yeah.
And so, can you talk a little more on the calcium? How does someone ensure they're getting enough calcium? Like, do they need to eat it with their meal? And how is I guess the difference between someone taking a calcium supplement versus them getting it from the food?
Yeah, good question. I forgot to mention that supplement piece earlier. So ideally, in a perfect world, I would love to see all of my people with high urine oxalate having a good calcium source with each meal. So 3 meals a day, 3 servings of calcium. Um, and that is because since we want to really use that calcium to bind the oxalate in the food that we eat, ideally we really want to have that calcium with food or with a meal, so then it's all in our intestines at the same time and blocking absorption. If you're having yogurt, say as a snack, that's cool. It's not going to hurt you, but it's not really like maximizing that calcium effect on reducing oxalate absorption. So
Okay.
ideally we want to do that, or especially if maybe really want some raspberries, maybe just make sure that you have some yogurt with them, especially if you're having a really higher oxalate food, just be really cognizant that you're having a calcium source with it. So a lot of time, and like calcium sometimes gets old, until we can certainly, and I think we will talk about some of the plant-based sources, but milk and yogurt get old when you're trying to have them 3 times a day. And so people will often say, well, why can't I just take a calcium supplement? So calcium supplements will definitely reduce oxalate absorption just as well as natural calcium. However, calcium supplements raise urine calcium much, much, much more than natural calcium. And we see
Okay.
in big studies that people who take calcium supplements have a increased risk of stones, whereas people who eat enough calcium have a much lower risk of stones. And so for the vast majority of people, we really want to get calcium from food. There are a couple exceptions. The one that I see most commonly is people who have stones as a result of bariatric surgery. Their physiology is very different, and so their urine calcium likely isn't going to be high. They're making stones because they have crazy high oxalate absorption. So in those instances, it does sometimes make sense. But for
Okay.
most of us who are forming stones, because of some specific thing like that, we really want to avoid calcium supplements whenever we can.
Got it. And so, can you go over some good calcium sources, both for just in general, and then also if someone is, vegan or plant based or dairy intolerant or allergic?
Absolutely. Absolutely. So yeah, so for most people, I recommend milk and yogurt, a dairy. That's going to have the most calcium in it, most natural calcium. But obviously, people avoid that for a variety of reasons. And if that's the case, then doing those plant-based milk substitutes, I think, are completely fine. So specifically milk. So things like rice milk, coconut milk, macadamia nut milk, those are all good options. I would be careful with almond milk just because even though we don't all need to avoid oxalate, I don't want you to, start drinking a whole bunch of almond milk and you're introducing this huge sort of concentrated oxalate source, right? So those uh, lower oxalate plant-based milks, I think, are a good option. I actually have a post on my blog that goes into all the different options, so maybe we can add that to the show
Awesome.
notes as well, so people can easily
Definitely.
find that. So yeah, I think those are kind of what it comes down to. I think cheese can be an option too. Again, just because milk gets really old. Cheese is going to be higher in sodium, but that's okay, because you can easily fit it into your daily amounts. I think especially the vegan cheeses tend to be very, very high in sodium, so just kind of be mindful of that. But I still think there's room for that. Again, just to kind of mix it up when we're trying to get 3 servings a day in, it we have to have variety.
Definitely. So,
Mhm.
can you give an example of a day that's, for someone who is trying to prevent their kidney stone from reoccurring, that's breakfast, lunch, and dinner, and just an example of what that meal would look like?
Sure. So breakfast, I think oatmeal is always a great option. I like it also because you can make it with milk. And so again, people get so sick of milk. So if you just make your oatmeal with milk, you sort of hide it and you don't have to have another glass of milk with it. So you could have oatmeal and then put whatever fun toppings you love. So maybe you could do cinnamon and apples and a little bit of brown sugar. You could do like pistachios and blackberries, adding some extra, making sure you have some fruit or vegetable with it. So fruit, I feel like fits really well here. And having some nuts, I think, adds some extra fiber and some other good magnesium and phytate for kidney stone prevention. If you do have high urine oxalate, just avoid those higher oxalate nuts and you'll be totally fine. So I think that's a good option for breakfast. For lunch, you could maybe do a salad, maybe with some garbanzo beans for protein. You could do, I don't know, you could do like a spring mix with some tomato and avocado, onion, carrot, whatever vegetables you love. I love garbanzo beans on salads just because they're easy. I get the low sodium canned ones, rinse them off and throw them on. So easy.
Yes.
And then to make sure you're not blowing your sodium budget with dressing, just make your own dressing at home. You could use whatever vinegar you like, and olive oil, a little bit of garlic powder, whatever. Um, so that might be a good lunch. Maybe add a whole grain roll with it so you have a healthy carb to help fill you up. And then dinner, maybe have a piece of salmon. You could have some wild rice and asparagus. Maybe have a cookie for dessert because there's certainly room for a little bit of sugar and some treat in there. Yeah, so kind of hopefully that gives you some idea of what an example day might look like.
Definitely. And so since you brought up sugar again, I know you mentioned it earlier with, beverages that contain sugar, but
Mhm.
what is the link with added sugar and kidney stones?
Yeah. So we actually don't quite know. They're actually, one of my old colleagues at the University of Chicago is looking into this. We don't fully understand the physiology of why added sugar specifically increases the risk of stones. We're not afraid of sugar in fruit. In fact, fruit is very wonderful for kidney stones, as we talked about earlier. Also wonderful for kidney disease, as I'm sure that you talk about all the time. But we know that it has some link with higher urine calcium for whatever reason. We used to think it was insulin mediated, but now we think maybe that's not the case. So we're not quite sure how, but we know that more added sugar is associated with higher urine calcium. And so you see in specifically those drinks, perhaps because they are just, so high in that added sugar, we definitely
Right.
see a higher risk of stones. And so certainly some sugar is fine. All foods fit. I'm a strong believer in that. But having, a huge piece of cake every day or tons of ice cream or whatever, right? That could increase your risk of stones by increasing urine calcium.
Okay. Got it. Thank you. And before we kind of wrap everything up, you had mentioned avoiding cinnamon and turmeric supplements because they can be
Mhm.
very high or concentrated in oxalates. Are there any other supplements that can be risky that people should avoid? And are there any supplements that are good for people with kidney stones?
Yeah. I think the only other ones is calcium, which we touched on already. And the other big one is vitamin C. So vitamin C, to add to the confusion and complication of oxalate metabolism, your liver can make oxalate from lots of different things, excess protein being one of them. So sometimes people in the extreme low oxalate world will say like, oh, like carnivore diets are good because there's no oxalate. But in addition to many, many things, it doesn't even make sense because if you're eating just a ton of meat, your liver is actually going to make oxalate from all of that protein, which it's kind of ironic. But um, so so one of the things, in addition to those that protein and amino acid that your liver can make oxalate from, is excess vitamin C. So very high vitamin C supplements. I would definitely avoid, especially if you have high urine oxalate. So, if there's a little bit like, I don't know, 60 milligrams or something and a multivitamin that you take or whatever, like that's fine. But it's the very high doses of vitamin C that we want to avoid. Other than that, I don't think there's any other ones to avoid. Supplements that are good, definitely nothing that I recommend universally. In rare instances, I will recommend fish oil for stubborn high urine oxalate. There's some data to show that fish oil supplements could bring that down. Um, yeah, other than that, sometimes magnesium. I have a whole post about this as well. Low urine magnesium could be problematic, but the data showing that magnesium supplementation makes any difference is very, very lacking. But if you have low magnesium, I think that perhaps there could be a role there. But these are very rare, very specific situations, and there's really no supplements that I recommend for everyone or even for big groups of people.
Got it. Okay. So to sum everything up, what are your top 3 to 5 nutrition tips for people with kidney stones? If you can just pick 3 to 5.
Okay. I would say for everyone, drink water. Again, we want to drink, for most of us, around 3 liters of fluid per day. That's about 100 ounces of fluid per day. Mostly from water. That's obviously going to be your best choice, but mixing it up. My favorite recommendation are those unsweetened sparkling waters. Sometimes people ask, does carbonation matter? It doesn't. If there's lots of sugar in what you're drinking, that does matter. But like LaCroix or Spindrift or Bubbly or any of the gazillion different brands, they're all fine as long as there's no sugar added in them. So drink water is definitely my number one tip. I would say the next thing, and this is specific to each person, but because calcium oxalate stones are so common, and most of us are eating more salt than we need to anyway, I would say limiting how much salt you eat is or not limiting, making sure you're not eating too much salt because some of us may be fine, but most of us are eating way more salt than we need, right? So,
Yeah.
trying to aim for around 2,300 milligrams of sodium per day. That's also going to be good in general, right? It's going to be good for your kidneys, good for your heart, and just disease prevention in general. So, I would say sodium, and then I'll have 4 things. The next thing would be making sure that you're getting enough calcium. This recommendation for 3 servings of calcium per day, or around 1,000 to 1,200 milligrams of calcium, is actually the recommendation for the general public as well. For people with kidney disease, that might be a little different. So definitely ask your doctor, your dietitian, what's best for you. But I would say for stone formers and for the general public, trying to get in that calcium is very important. And then my last point would be just make sure you're eating your fruits and vegetables, at least 5 servings a day. That's going to help with stone prevention and also general health and every chronic disease under the sun. So there's my 4 tips.
Awesome. Well, thank you. That's very, very helpful. And Melanie, can you, we'll put links in the notes for this episode, but do you want to remind everyone kind of what resources and services you have for kidney stones and how people can find you?
Yeah, absolutely. So my blog has a ton of information on there about kidney stones. So that's thekidneydietitian.org. I also post on Instagram at the kidney dietitian with periods in between each word. I'm on Facebook if you want to check me out there. I have a Facebook group, the Kidney Dietitians Kidney Stone Prevention Community, if you want to look at that as well. And so those are all of my resources. And if you want to work with me or really help, really dive into that 24-hour urine test to understand what's going on and what you can do for prevention for you, definitely check out Kidney Stone Nutrition School. That lays it all out for you. And I also help students dive into that test, and you can join in group calls with me to kind of get my direct help in understanding what this should be for you.
Got it. Well, thank you, Melanie. This is so helpful. We get lots and lots of questions about nutrition for kidney stones. So it's great to have an expert on to really lay it out. And again, I think this is listen to this episode a couple times, you guys, and take notes because there's a lot of great information. And then if you need more, then you can go to Melanie's website. You can go to her Instagram. You can join her Facebook group, her course. She is really the renal dietitian expert in kidney stones. So I'm so happy that you came on, and thank you.
Yes, thank you for having me.